In cosmetic surgery, beauty is defined according to the symmetry and the proportions of the face. So typically, anytime we have patients for consultations, regardless of what the treatment is, we focus on restoring the balance of the face, so there are a lot of different geometric proportions. For example, the distance from the chin to the nose, nose to the eyebrows, eyebrows to the hairline should be more or less 3 equal thirds. The more symmetric one is, the better looking. As human beings, we are programmed to judge other human beings not according to the race, not according to the age, but according to the geometric proportions of the face. So a lot of the times we're seeing patients, especially in the past decade, there was a very popular trend of playing with our own eyebrows. So the ladies started plucking them out if they didn't like their shape. Tattooing became very popular. So one of the biggest problems with the tattoo is that, let's say if a lady goes out to have the eyebrow tattoo done, let's say at the age of 23, 24, so they might position them, like, let's say right here. So as the same lady or a man, but typically ladies are doing the eyebrow tattoos, as they start aging and the rest of the face starts to fall downwards due to the gravitational pull, and the rest of the face starts to come forward, these eyebrows end up not looking very proportional. So the symmetry and the proportions of the face become distorted. So a lot of the days we will see, for example, very elevated eyebrows, and due to the drooping of the rest of the face, it's very disproportionate to the rest of the features. So typically what we do is we start with a tattoo removal, but then because all the tattooing and the microneedling with the tattooing process, a lot of the follicles have been damaged. The only way to actually restore the natural appearance is to actually transplant. So in terms of eyebrow transplant, the same procedure follows. So the candidates are not only patients that have had the tattoos, but also those who possibly have overplucked and then they found that over time part or entire eyebrow just failed to grow, because typically the hair growing on the eyelashes and the eyebrows, they tend to grow in single follicles per root, whereas on the head, especially the donor dominant side, each root contains an average of 2, 3, 4 follicles per root. So it's quite easy with overplucking for this follicle to become overexhausted and to just stop producing the hair altogether. So what we are doing is, again, we are measuring the proportions of the face according to that person's age and the symmetry at present, and then we decide on the shape and the density and the thickness, and then basically the same procedure follows. We need to extract some of the excess donor dominant follicles from the back of the head, which is again a minimally invasive procedure. It's a day procedure, so it's done, the eyebrow transplant is typically done in about 2-3 hours. It's done so we would anesthetize the area, we would excise the follicles, we would splice the follicles into single hairs, which is naturally how the eyebrows are growing. We will apply topical and local anesthesia to the area. We will create very small incisions in the skin in order to insert the follicles, and the same procedure follows. The skin will absorb the roots within 48 to 72 hours, and then the hair will start to grow about a month after, average 10 to 15%. There is a little bit of an accelerated growth for the facial hair transplant because there is extra blood supply in the face compared to the head. So we're typically seeing the results in about 3-4 months for the complete eyebrow to be transplanted. And again, any makeup or tattoo, it never looks as natural as actual hair that should be there. Now, the only difference is this, because of course it looks 100% natural. However, eyebrow hair typically doesn't grow very long, so it's programmed to grow very short, whereas the transplanted hair from the donor dominant side is the hair from the head, which is programmed to grow long. So the only difference is that once a week the patients do need to trim the eyebrows so that they don't grow out long. But the rest of it, they can just treat it normally. So they can apply pencil if they need to pencil in any to play with the shape. They can just apply normal facial makeup, everything else. There are no special precautions. The typical healing is only 3 to 4 days. There is a little bit of redness that can persist anywhere from 3 to about 5 days. So during the initial healing, which is about a week, we do proactive follow-up. So we will clean and exfoliate the skin. Afterwards, the patient can resume normal life. In the beginning, until the hair grows out, they can go back to applying makeup just until, to keep the desired look and the desired shape until the natural hair grows out, which typically for the facial transplant is about between 4 to 6 months, more or less. Now, the studies do indicate that the follicles, once they're transplanted in about 3 to 5 years, the genetic makeup of the follicles will change. So basically, the follicles taken from the hair, which are programmed to grow long, once they're transplanted to the face, after a couple of years, they will start to behave as the facial hair. So they will go according to the DNA map of the facial hair. So 3-4 years down the road, they will start to grow short. So no need, there will no longer be a need for the patient to continue trimming the eyebrows. And then the same goes for the eyelashes. Yeah, for any transplant, whether it's for the hair, whether it's for the beard, by the way, that's very popular in this region, with the local culture and beard being very popular part of their image. We're doing a lot of facial beard transplants for men. For ladies, we're doing a lot of eyebrow transplants and even eyelash transplants due to the damage caused by the eyelash extensions. Eventually, the eyelashes stop growing and they will notice a lot of gaps. So for all of these transplants, always we have to use the person's own hair. Nobody else's hair can be used to supplement our own hair, our own DNA. So we have to use the person's own hair, which is always taken from the outer margins of the head, which is classified again as the donor dominant hair, where we have surplus follicles, average 10 to 20%, which can range in anything from, let's say, 2,500 grafts to anything up to 8,000 grafts, and each graft contains multiple hairs. So let's say if we average 3 hairs per graft, we have approximately 20,000+ extra follicles right at the back. So we have plenty of extra hair right out the outer margins of the head, which we can utilize for eyelashes, for the eyebrows, for the facial hair transplant, as well as, of course, for any thinning that may occur. So when it comes to eyelash transplant, the same procedure applies. Again, we're again utilizing the surplus follicles taken from the donor dominant hair. However, we have to make sure, a lot of the times we're having ladies with already perfect natural eyelashes, which tend to, for example, maybe be a little bit on the shorter side. So those are not the candidates for eyelash transplant. The candidates for eyelash transplants are patients that have gaps in the eyelashes. So somebody who naturally has very thin and sparse eyelashes, or somebody who has this condition due to a long period of not so much plucking, but of using the eyelash extension, because each time they're going in and applying these artificial eyelashes, when they're being removed, some of our natural eyelashes are being taken out. So over time, whoever is used to wearing these artificial eyelashes, they will notice a lot of gaps. So the natural way to reverse this procedure is to conduct a transplant. So basically, we would again need to apply a local anesthetic to the upper eyelid. Once the area is numb, we will just create small incisions right around the outer, right around the lash line, and then we will insert the follicles. We can create very high density eyelash restoration, but again, same as with the eyebrow, same as with the natural, the donor hair is programmed to grow long. So the patients do need to understand that in the beginning, the first couple of years, they will need to get used to trimming the eyelashes at least on a weekly basis. They will grow long, so one can control the length that they wish to have, but they do need to be trimmed, because otherwise they will grow as the natural hair is programmed to grow long. So this is the only thing that they do need to sort of accept, is that in the beginning, it needs to be like part of the day, part of the weekly routine. Eyelashes and eyebrows need to be trimmed. And that's the only thing, but it can be, normal making can be applied. It's very safe because, again, it's anything that's done under local anesthesia. All of the surgical side effects that are affiliated with larger procedures and general anesthesia are eliminated. So it's a day procedure. Typically, we do prescribe for any sort of soft tissue augmentation and any minor procedure, including any sort of hair transplant, whether it's eyelash, eyebrow, hair, or beard.